Everyone's on the Ozempic. It's a thing.
Yeah.
And I'm starting to be able to tell the people that are on Ozempic.
Yeah.
You get Ozempic face.
Yeah.
It's a thing, see?
It's a thing, but
What's
it's
Ozempic face?
So Ozempic face is something that people made up to scare people that are on Ozempic. Because the honest truth is, whenever you have rapid weight loss, you're going to lose weight in your face, right? And so even if you do it naturally, you're still going to lose that weight. If you do, if you have a gastric bypass, you're still going to lose that weight. You're still going to, you know, have that decreased volumization, decreased laxity of your skin.
Yeah.
And so, but in LA, it's really difficult to get semaglutide, which is the generic form of Ozempic.
Okay.
And people are charging like, I think, $2,000
It's crazy.
plus.
Yeah.
And only celebrities are able to afford it.
Yeah.
Which is, it's crazy.
But here in New Jersey, it's easier to get.
Oh, 100%.
New York, New Jersey.
I just had a patient move from New York. She was on semaglutide, and she lost like 15 pounds, but then she had to move to California, and I have to find her a new doctor because
she can't get her hands on it.
She can't get her hands on it.
Oh.
It's very LA.
It's so LA, which is in our battle from New York and LA. I'd just like to let you know another reason why New York is better.
Because you can get your hands on Ozempic.
On all the good drugs, honestly.
Yeah.
Just kidding. But Ashley, I know when we were on your side,
Yes.
we talked to Dr. Roberta.
So we had the girl that I go to for all my injections on the show. But now,
Sitting with us here today,
yes,
Dr. Lanna.
Dr. Lanna.
And when you got good titles, girl, we like to read them.
Yeah.
Okay.
She's
We
a
need the full
master
bio.
injector, a trainer, speaker, CEO,
Yes.
and now thought leader and executor in the sexual health and wellness space for women.
And she can get her hands on Ozempic.
And New Jersey.
And New Jersey.
And New Jersey.
And Florida.
Yeah.
I have licenses in all 3 states.
You go, Dr.
That's
Lanna.
licenses, degrees, all the things.
Yes, all the things.
So when Ashley and I had a sit down on the West Coast in season 1, I was a girl who was very anti-fillers, anti-Botox, everything.
Everything. She wasn't even into Botox.
Yeah.
Like the very least of the injections.
Right, and not everybody is. You know, you have to
Yeah.
kind of see, you know, natural is beautiful, but you can be natural and still get some enhancements.
Yeah. I felt like it had become almost just like a popularity thing
Yeah.
to just have fillers or Botox.
Right.
Largely in part to the female celebrities that were leading the charge on beauty at the time.
Right.
Right.
But you know, age comes at you fast.
Hit you fast.
It had you. I was 3 years younger then.
You were.
3 years later.
Man, 3 years later,
start to
Ashley
open
has
up.
joined the wild side
What were your reasons for getting Botox or to start getting Botox?
because I was starting to get lines that when I stopped frowning, I could still see them.
Got it. And that bothered you.
That bothered me.
Yeah, those are called static lines.
Yeah.
And, you know, I always kind of teach my patients that when you have a piece of paper and when you crease that piece of paper, it's really hard to uncrease that piece of paper. And so what happens is when you're moving your muscles, your glabella, your frontalis, which is like your forehead muscles, the more you move them, the more that crease is being made. So in essence, if you don't prevent that crease from forming, it's almost, I would say, almost impossible or very difficult to soften those lines later on. So it is, in essence, more preventative and helps with other medical issues as well, like depression. It decreases depression. Did you know that?
No.
Botox in your glabella actually decreases depression. It's FDA approved for migraines. It's actually first used in, you know, strabismus, which is cross-eyed. I just kind of realized that after they start using it for the eyes, they saw that the wrinkles were better. So people with cross-eyed actually, you know, the wrinkles kind of disappeared.
Not
and
only
so
were they not cross-eyed anymore, they also had fewer wrinkles.
Exactly. So they looked amazing. And that's how that came about, which is a lot of things in science, right?
Yeah.
You kind of find like a secondary improvement that you can get and you know, and it's efficacious in certain things. And so it became a really big thing for aesthetics.
Yeah. I have jumping eyebrows.
Jumping
That's
eyebrows?
why Dr. Lanna is here.
What's jumping eyebrows?
It's like my eyebrows are.
Jumping out of your
We
face.
call it
Botox got
spocking.
messed
Like
up.
spocking.
Yeah.
What's spocking?
Look at my eyebrows.
Uh-huh.
Like
See how
Star
they're
Trek
like
spocking.
lifted?
Oh, it's almost like you're kind of saying, huh?
Yeah.
But you're
but
not.
I'm always kind of saying, huh.
I don't hate them.
Really?
Me neither.
I don't
You
hate
like
them.
it?
For me, because I have, very
Yeah.
small eyes. So like whatever I can do to lift up
Lift
like
it.
crazy. So I kind of let myself spock as much as possible. You basically just let that muscle pull up as much as possible, but it's not for everybody.
Well, the thing is, I've gotten Botox several times, and this is the one time that people noticed I got it. Like my nail lady said something. She was like, "Oh, did you do something to your face?" And I was like, "No, why?" She was like, "You look." I was like, "Fine, I got Botox." She's like, "Yeah, I can tell." I was like, and Deshaun noticed too.
Oh.
And never has he noticed I got Botox. So I could tell that it changed my face more than I probably wanted. But
because
that was
he
my
know
bad
you
week.
know he knows your face inside
Yeah.
out. Yeah.
Sorry.
But did he not like it, or he just thought of something different?
He was like, "You did something." He just doesn't want me to do anything.
Why are men like that?
I don't know. Do you notice that?
Why men are like that?
Yeah, like men don't want us to be better versions of ourselves.
Men think that a little Botox filler is going to make you look like cat lady.
Yeah.
And they don't understand that, the beautiful people that they see on TV, it's all Botox, all fillers, all like Photoshop. And they just don't understand.
They don't understand.
Yeah.
They
Yeah.
don't understand.
But I feel like they're starting to, because I walked into your office in Midtown Manhattan, and every time there are men in there.
What do men get the most? Botox?
They do get Botox.
Botox.
They're a big fan of semaglutide because everybody needs to lose weight.
Oh.
And I also do a lot of sexual health as well. One is for function and one is for cosmetic. So when somebody comes in, we ask them exactly what's going on. And a lot of times it's actually not true ED, which is erectile dysfunction, but it's kind of more mental than it is a true medical issue. So for instance, one of the things that we like to ask is during the middle of the night, do you have nighttime erections or morning erections? And if they say yes, but they're unable to perform or their durability doesn't last, it could be more mental. And that's the difficult thing about dealing with men and erectile dysfunction, because there's so many things that come into play, right? I mean, not
Yeah.
only is, are they diabetic? Do they have hypertension? Do they have coronary artery disease? But it's kind of like, well, how are you in your relationship? And then sometimes they'll say, well, I have erectile issues when I'm with my wife, but not with my girlfriend.
Oh,
And
I love that for you.
yeah, and so that's more of a mental issue. And then the porn industry has really been not helpful with ED, because a lot of men who really watch a lot of porn are so used to getting that type of visual and audio stimulation that with normal engagement of intercourse, they're not able
not enough.
It's not enough. And so for those patients, we always say, like, just stop watching the porn. Yeah.
So sometimes you have to be like a therapist.
Yes. In fact, yeah, it is.
But if their dick really just doesn't work,
Yes.
is there something besides like
Viagra.
Viagra that you can give them?
Yeah.
Oh,
yeah.
So there's like fillers?
So one is oral PDE5 inhibitors, Viagra, Cialis, Levitra.
Yeah.
Then there's injections. So men inject their penises.
No, that hurts.
No, it doesn't. I
Nope.
promise it doesn't.
You have to numb it.
They don't numb. No. It's a very small needle. It's like an insulin needle. It really doesn't hurt.
What part of the penis do you put it in?
On the sides, 3 and 9 o'clock position. It's immediate too. I mean, you stick it in, and like
it
within
can-
seconds, they are fully erect.
So
It lasts until you have an orgasm. If it lasts any time longer than 2 to 4 hours, you have to go to the hospital. We need to take it down. We got to give you an antidote, because then you can get permanent disfigurement and permanent issues with erectile dysfunction. Basically, the blood is there. It's trapped in there. It can't get back out.
But so when men come in and you're saying it's immediate but only lasts 2 to 4 hours, so they're like coming in right prior to wanting to go and get it done.
Well, you mean for the injection?
Yeah.
Oh, they come beforehand. We teach them how to do it. Then they bring it home.
Oh, they do it to themselves.
And then they inject themselves at home.
Really is like Ozempic.
Yeah.
Wow, that's so interesting.
And then the ultimate step, if that doesn't help them, let's just say they're, really poorly controlled diabetic and they have hypertension, they've had a, myocardial infarction, which is a heart attack, then we can put a 3-piece penile prosthesis in their penis.
Oh, so there really are penile implants.
Yes, like pump.
And you really
in the
pump it
scrotum.
up.
Yep, we put the pump in the scrotum, the reservoir, you know, in their abdomen, you know, behind the pubic bone, and then
what do you do? You go like this to pump it up?
you in the scrotum. So if they're righty, we put it in the right hemiscrotum. If you're a lefty, we put it in the left scrotum. And you pump it up, and then the water that goes from the abdomen goes into the corporal tissue, and so you have this really rigid, you know, silicone like cylinder in your penis. Yeah. And that's for function. That's not even cosmesis. That's not even to make you girthier or longer. That's just to get an erection. Now, we do things that make you girthy. Like you asked about fillers, which is something that makes you a little girthier, a little thicker, hang a little bit lower, hang a little bit bigger. It's like the locker room penis where, you know, we're looking at you, Derek. I'm sorry. You don't mean to be. But yeah, a lot of men just want things to hang a little longer. And we've actually been doing studies now doing Botox into the penis to make things relax, to let the muscle hang longer, so that in a flaccid state.
Saying, why would you want the muscle to be?
Because they want hang time.
Yes, it's called a locker room penis. There's a lot of men who get really embarrassed being in the locker room naked, and they remember from like, you know, back in like when they're teenagers how embarrassed they were, and they carry that with them, you know, for the rest of their lives, even if their wives are happy. Yeah, that's a lot.
That's wild. That's what I'm saying. So some men are like, no, stay away, don't touch, and some men are totally open to explore even intimate areas.
Yeah. Oh, yeah. They're open.
So here's my question. When you're dealing with that, would you say that there is a higher percentage of gay men that are interested in doing that? Or would you say that it's a higher percentage of straight men?
That's such a good question.
Yeah.
We get both. With gay men, a lot of them just want enhancement per se. They may not have like a true medical issue. With straight men, I mean, it happens with both, but some of it is psychological, right? And even though like their wives or girlfriends are happy, they still feel like it's not big enough, right? And so they really go the extra mile to try to gain that girth and that length. And they're willing to pay money for it, like lots of money.
Lots of money, because that cannot be cheap.
It's not cheap. Actually, the surgery itself for what we call the pneuma implant or silicone, you know, how women get silicone breast implants.
Yeah.
This is a silicone implant placed in underneath the skin onto buccal fascia. We suture it in place, and that's like $15,000 to $16,000, you know, with some urologists.
Do you see why someone like me, who is like super skeptical, meets Dr. Lana and is like, all right.
No, you know what you're talking about.
I trust her.
Yeah.
I trust her.
If I cut penises, you can trust me with your face.
Yeah, exactly.
There are men that are comfortable with her sharing these intimate details, trusting her opinion on. So like I had to.
Yeah.
Also, she's probably the best person that if you were going to share these insecurities with,
to
like make you feel comfortable in this space, right?
They say once you start, you can't stop. So it's like getting started.
There's a lot of folklore around it.
It's a slippery slope, right?
Right.
Is that true?
I think Botox is life-changing if done the right way, right? Because you just look like you, but you just look more refreshed, right? And you look just more like well-rested and more youthful. With lip fillers and other fillers, I do see how it could be a slippery slope. And I'll tell you why that is. It's a slippery slope because once you start, you get this immediate swell, and whether that's your cheeks lifting, whether that's your lips swollen, and at first it's a little jarring because you're looking at yourself, you're like, ooh, this is
a lot.
You know, a lot.
Yeah.
It's swollen, but in a good way. And then when the swelling goes down, you miss the swelling.
Yeah.
So when patients come back to me, they're like, I want the swelling like I had on day 2, right?
Yeah.
And so, but here's the thing, you keep chasing because every time I re-inject you, you're going to get even more swollen and more, you know, so bigger. So that's why we go slow. I like to do it in 2 stages. And that way you can get perfect symmetry, because the other thing too is when it's swollen, as an injector, like you don't know exactly where to inject because it's already swollen. You put too much on one side and that's just from swelling. Then when everything comes down, you're going to have some asymmetry. So I like to do it in 2 sessions because I found that the patient satisfaction rate like skyrocketed.
So you kind of sell it that way? Like
funny
you
enough, I don't.
Oh, you don't?
I don't.
But you just suggest it.
Yeah, I suggest let's not do the whole syringe today, and we actually backload it so that I have more precision. When you go from a huge needle like this and you're injecting with a big needle, you don't really know how much you're putting. And a lot of this is artistry. It's not like, okay, Dr. Lana, I'm going to, you're going to put in 0.1 here and 0.1 there, right? You're just injecting it
and like hoping that
right,
it goes.
Right, and that the patient's tolerating it well. So that's a big thing too. When my patients are in pain, they don't tolerate it well. It makes my job a little harder because I'm afraid to put in how much I need to put in at one time. So I think that's also good too that I split it over 2 sessions so that we can add more for that second session.
So I finally attacked that very gummy smile I have, but mainly because I was going to the dentist. I was getting ready to do an expensive, painful procedure to do a crown and lengthening. And before I did that, actually, no, my dentist appointment was scheduled and I missed my flight and I had to reschedule my dentist appointment. And I had booked a consultation with Dr. Lanna months before. And so I didn't end up getting on my flight and I didn't end up going to the dentist. And then I got a call from her office like 24 hours before that was like, hey, you having a consultation tomorrow? And I was like, oh, crap. Like, I guess I'll just go. And I was like, hi, I'm Ashley and I want lip fillers because my teeth are little and my gums are big. And she was like, hi, I'm Dr. Lana and that's not what you need. I was like, okay, tell me. And so that was part of almost the immediate trust, right? It's just like, hey, that's not the only solution. Let me present you with some solutions. Now, we can go your route if that's what you want, but that's not the solution. And I just think the level of comfort I felt almost instantly allowed me to not only say okay, but to walk out of her office with something done like that same day.
As a first-time patient that comes to me, especially someone who's a little timid and not really sure, I always want to go the route of being more conservative, right? I never want to push. And I felt that it would benefit her from using Botox to decrease the gummy smile because really a gummy smile is a constellation of, your muscles pulling too high up here. Maybe the lip, flips in a little bit, showing a lot more gum when you smile. And just a little bit of Botox was able to not only relax that gummy smile and that gummy pull, but also give you a little bit of that like eversion of the upper lip without
lip
filler.
flip.
We call that a lip flip. Yes, you know it, girl. Yes.
Okay.
So that's what we did with her to start. And I told her when she's ready for lip filler, we can go in and do some lip filler. And she came back.
So with Botox, what is your suggestion for upkeep? Like how often are you supposed to like get Botox?
Every 3 months.
Every 3 months. Yeah,
Every
that's what
3
I
months.
thought. Because it metabolizes, right?
It wears off.
Yeah.
It causes, it wears off over time. Usually at the 1 month mark is when you have like the most, that climax of paralysis and smoothness. And then, at the 2 months, you start to get a little bit of movement back. But it's so interesting because it is like a Cinderella effect, right?
Yeah.
It's like, it's midnight, it's been 3 months, and all of a sudden you're like, oh my God, what happened to my face?
Yeah.
And everyone's like, oh my God, my Botox is completely worn off. But if you take a photo or video of what you look like before the Botox, there's still some there, right?
Yeah.
But it just happens kind of quickly. And so you're like, oh my gosh, it's worse than before, but it's not. Yeah. So it is preventative because if you did nothing for 6 months versus Botox times 2 for 6 months, when you look at the befores and afters, you're still going to look much more youthful after getting Botox for 6 months than if you never had anything done before.
I had a whole moment after. So you definitely told me that I can't drink out of a straw. She definitely said
Can't give a blowy.
She definitely said no aggressive kissing.
Yeah.
I was like, I'm not 14. I don't make out. She means don't give head.
Yeah.
No
blowies.
I understood what she meant, but like my lip didn't freeze. For 2 weeks.
Right.
And then it froze.
It takes 2 weeks.
What?
Yes.
I could not drink out of a cup, out of a straw, out of nothing, but it came out of nowhere because I was fine for like the whole first week and a half.
Really?
Yeah. Once it kicks in, you're
and
like,
then it just hit,
how do
and
I
I was
close
like,
my mouth?
Girl, I could not. I still can't all the way. Well, I couldn't rub my lips together. Like I got my makeup done, and she was like, "Okay, Natasha." She was like, "Okay, plot your lips," and I was like, "Oh shit, I can't." She's like, "Well, I can't." My lips.
So try and smile big. That's like as much as you can smile. Yeah.
Like you can see how hard I'm smiling.
Yeah. I always tell my patients,
And
spit
this
a
is
finger.
that I've hit my climb. I'm on the decline.
Yes,
on the
yes. You're
decline.
starting to move again.
Yeah.
But yeah, I always tell my patients it's not going to last. Like that feeling of like you can't sip on a straw, whistle, and eat, right? And
I thought it was stuck.
You
And
thought
I
you were
thought
gonna
this was
die.
my new normal. I was like,
Yeah.
my new normal is that I can't use
can't
my
go-
top lip.
So does Botox always kick in late?
Botox takes about 7 to 14 days
Oh,
to
okay.
kick in. Yeah, so it doesn't happen right away. Yeah,
You know, my pain tolerance is low.
Low.
Like,
yes, love
like-
Very low.
no, it's low.
It's next level.
Like, I've cried with her taking a COVID
A
test.
COVID test. I was like, Ashley,
Yeah.
just a swab.
Yeah, I know, but it hurts. It doesn't feel good.
Yeah.
Anyhow, she was just like, okay, well, what do you want to do? Do you want to wait? Do you want to take some time? And the previous experience I had in Miami, she was like, there's no time to wait because you're going to swell and I can't see what I'm doing.
Oh, yeah.
And so I understand the logic. I'm a logical person. So like,
Yeah,
I
yeah.
get that you need to move, but like also it's not working for me. And it was not the best experience for me. And then I went and sat down in her chair and she's like, do you need a second? And in my mind, I'm like, you don't have a second. Hurry, bitch. There's no time left.
we had like an hour with you.
No.
It
And
took like
she
an hour.
literally,
It did.
it took an hour.
Yeah.
Oh my God, my Botox takes like 10 minutes.
Most people, I'm sure. But for those people that are scared or
Yeah,
worried or whatever,
it's
I
nice
just
to
want to
know.
reiterate
Yeah.
how important the provider is.
No, it is.
It's game changing, not just in your results, but your entire experience. It's not, people's pain tolerances can be very high. Mine happens to be low, but in general, it is not actually a pleasant experience. Every single person I've spoken to that got their lips done has said it's probably the worst area
Right.
or the hardest area.
Anything around your lips is tough because it's a lot of like nerve.
A lot of
end-
yes, a lot of nerve endings. But we do have people that actually do not want any numbing. They just want me to go for it.
Just go in.
But
there.
are they like super perfectionists that just want the job done so precisely?
Yes, but then there's also people who like pain. And I get those people too.
Yeah.
I'm sure you. See
But I tried
all
to
of
inject
it.
myself without numbing, and I was like, oh no, this is not happening.
So do you inject yourself?
I used to.
Oh yeah.
I remember trying to inject my tear troughs, which is my under eyes. And then I looked at a video afterwards. I was like, yeah, I wasn't on bone there. You have to be very careful. You're on bone. Otherwise,
Yeah.
you can get into a blood vessel. I'm like, yeah, I'm not going to do that anymore. And now I have all these amazing people that work with me and for me.
Yeah.
You
that, and they-
trained.
that I trained, and I trust them 100%.
Trust them.
And they do my face. So
Yeah.
I no longer inject myself.
Okay.
So Dr. Lanna, as the entrepreneur and CEO, what made you want to go from just like treating patients to teaching?
That's a great question. I mean, I've always loved teaching, but I'm going to tell you one thing. When I got into this field, and remember, I'm a urologist, right? So I did like prostate surgery.
that
I did
was your
robotic.
start.
That's when my start. I did robotic surgery. I took out prostate cancer. I took out kidney stones. I took out bladder cancer, kidney cancer. And I did all that for 10 years. I went to Brown, and then I had my 2 children. And the story is that my firstborn was born blind, and she's autistic. My second child is also autistic, but she can see, right? And so I knew I had to switch it up a bit. I know I'm getting a little emotional, but I knew I had to switch it up a bit. And I remember asking the hospital administration, my chairman, whether or not I can get more money because I worked all the time. I'm always on call. I never took a vacation. And I remember asking him for more money because I found out that the males in my program were getting 6 figures more than I was,
Wow.
even though, you know, I worked very, very hard, probably harder than
You had two things working against you. You're a woman and a minority.
and a minority, exactly. And so he said to me, well, if you can show me that somebody else wants to pay you more, then maybe I'll consider it.
Not you need proof.
So I got proof, and within like 3 months, I got a contract in my hand with more money. And you know what he said to me? He said, I can never match that. You should go there. And I said, okay. So I knew that my worth was not the same level as the other males, the white
Yeah.
males in my program.
Yeah.
And so I said, okay. So I started doing a side hustle. If I couldn't get more money, you know, at the job that I was killing myself for, away from my family, and I sacrificed so much, never went on vacation because I stayed for my patients, then I have to do something else to build for my family build an empire so that my children who will probably need help for the rest of their lives, a little bit more than what I can offer them as like a W-2 employee. And so I started doing this on the side. And I loved it. I thought it was like all vanity at first, but it wasn't. And my first patient said to me, you know, Dr. Lanna, people treat me better at work now. And I owe that all to you. And it's true. It's not just about like looking good, but it's also about like how you feel, how you project yourself,
how you feel,
like your persona, your aura. It really, it really is like, you know, really invasive in all areas of your life. And so when I started doing it, I realized, number one, I was actually pretty good at it, you know? And number two, I was making a difference. And sometimes as a urologist, you don't know if you're like really making a difference. Yes, you're curing cancer, but, you know, patients are sick and they may not be as, you know, happy.
You don't really feel the gratification.
Right.
Like, they have to heal after your surgeries. It might be 6-8 weeks.
They're in pain.
They're
in pain. Doing kidney stones. They're like in pain. They're like, what did you do to me?
They're like, you're the bad person.
So I didn't get that, like, I didn't feel like I was really valued.
Yeah.
And as an injector, making someone more youthful, having them after so much stress, divorce, death in their family, especially after COVID, looking at the mirror and saying, this is who I remember I look like before the death, the stress, you know, the divorce. And after that, I just felt like, okay, this is my calling and it's okay to pivot. So all these years, like the 15 years I spent of medical school, internship, residency, fellowship, all those years I thought I was going to throw away to do this, you know? So it was a struggle. But I actually, when I got pregnant with my second child, the hospital said to me, you can't do aesthetics on the side anymore. And so when I was 8 months pregnant with my second child, HR called me in. And I know it wasn't a good thing because when HR calls you in, it's not a good thing.
Yeah.
Just so you know.
Not to talk about new benefits.
Right. It's not about how can I get you more money. No.
Yeah.
It's we're gonna fire you because you're doing something on the side that we told you you can't do. And I had to swallow my pride. I mean, here I am, like always been like top of my class. My parents immigrated from China to come here to give us a better life. Like I always hustled to like get the best education, be whomever they wanted me to be. And then for me to get fired was like shocking. Yeah. But after that, I realized I had no safety net. I realized I have no other option but to kill it and to crush it.
Yeah.
And that's what I had to do. Because as a mama, when you have to take care of 2 kids now,
it's a different drive.
It's a different drive.
You kick into overdrive.
You kick into overdrive. And then I haven't stopped since. I went back to work 3 weeks after my C-section and my second child, and I never stopped. And I just kept on pushing, kept on going.
There is the moment in life when God removes the safety net that you finally fly.
Absolutely.
God will just say, no safety net, go try.
Yeah.
And baby, you will figure it out.
Yes.
Yeah.
I 100%
You're
agree.
gonna figure it out. That's so dope.
When failure is not an option, you just
don't.
You just don't fail. You
don't
just
fail.
keep going.
You just
You
don't
pivot.
fail.
Yeah.
Right? You learn from your mistakes. Have I made mistakes? Absolutely. But that's why, getting back to your question, is I train other people because I know that when I was in this situation, nobody wanted to train me. Everyone wants to keep everything to themselves.
Yeah.
But I believe in community over competition, and people are going to learn anyways. Might as well learn from somebody reputable and learn safe ways to do things. Yeah. And there's plenty to go around.
Man,
you know?
And
there's plenty to go
That's
around.
the thing.
And I find that with helping other people and being a good person, it comes back to you tenfold.
Yeah.
Right? Like good karma.
It always does.
Yeah.
And so how many employees do you have now a part of your practice?
I have about 15 total.
Sheesh, go girl.
And we're going to go into New Jersey. That's our next big step.
Yeah, that's so dope.
That is dope.
Yeah.
Thank you.
So in this like med spa business, like there's a lot of growth potential. Like it's a big business now.
It is, but there's a lot of corporatization of medical spas, and that's dangerous. It's also corporatization of medicine. You know, I think what Amazon's owning all these clinics now, and now the pharmacists are able to give vaccines to children, which is strange because if they have any issues, if they have any reactions, a pharmacist is not going to know how to deal with that. And the corporatization of medicine in general, but also in the aesthetic industry, it's tough because it's kind of like making like Costco, Walmart out of the medical industry. And the reason why it's not great for patients is because you're using a lot of like lower paid medical professionals, usually nurses, that are staffed, and there's like no doctor to be found. And you have to have a medical director that's there, that does the good faith exam. Everyone's skirting around that issue just because they want to make a quick buck. And that's a problem because all is fine and good until something happens and it's not fine and good anymore. And you're going to need, you know, a physician to be able to navigate through some of the potential complications, which could be devastating, you know?
That's interesting. I never thought about that. You're right. So people go to Walgreens for like their flu shot or whatever, but like you could actually have a reaction on site and then what?
Right. And for kids too.
Yeah.
I've never even.
You can have like an anaphylactic reaction, your throat closes up, and they're not going to know how to deal with it.
At all.
But, you know, they have strong lobbying, you know, power. So,
for sure.
Yeah. So that's the only thing that I see in our industry.
Growth, but scary growth.
Scary growth, because a lot of, you know, corporate private equities are purchasing up all these medical spas, hiring cheap staff.
Yeah.
And, you know, not doing the best job. And so, and the reason why I know this is because I get a lot of these patients from all these other locations that either are botched from Groupon or botched from being at, you know, at these locations that they don't really know, you know, how to really treat them. And I'll say the interesting thing is that these like corporate med spas target millennials and Gen Z.
I just went to a new place for laser hair removal, which is a med spa. They were like, oh, okay, our physician will reach out to you via phone before. 100%. And the woman called me and she was like, what is your like skin And I was like, oh, well, I'm mixed, I'm black and white. And she was like, okay, let me FaceTime you really quick so I can see your skin. And then like she FaceTimed me for like, she was like, okay, cool, thank you, you're good. And like hung up like that fast.
Yeah.
Like the conversation probably didn't even last a minute.
Right.
But they do all the fillers, injections, and all of this at this place. And I'm sure that all of these people are getting that same consultation to make sure that they pass through.
Exactly.
But it's like so cheap. Like I got laser hair removal like for like $80, like 4 different locations.
But it's not,
you know what I'm saying?
Yeah,
but that's how they cut the price because their physicians are sitting at home Zooming people.
Right.
Like,
you're not getting that full consultation. Have you ever seen that viral video where that lady got burned by an IPL and her face was all scarred?
But see, I'm terrified of that.
No, because she's you know, dark skin and a medical esthetician did an IPL on her, and you're not supposed to do this type of laser on dark skin, and her whole face was scarred.
I just saw a mom friend of mine at basketball practice, and she came up to me and she had all these burns all over her face. And she was like, yeah, I just had this laser done. And I was like, oh, what did you do? Because I've been wanting to do this laser to my face. And she said that she had done the Morpheus, but obviously the person messed up because I went through like the whole thing to get Morpheus, but never once did they mention burning as one of like your skin burning as one of the side effects. And I was like, oh, they fucked up.
Yeah.
Like they didn't do that right.
You should not be burned with Morpheus.
Not with Morpheus.
No. It's a very controlled heat.
Burn.
Oof.
Yeah.
It looked so bad, but that's like one of those things too where someone didn't
do the right settings, maybe didn't pre-treat the patient. Yeah. So,
and it's not even like I feel like in only cosmetic areas that the commercialization of medicine is happening, because it's like even now you can sign up for a program and they can send you medicine for ADHD or anxiety or whatever, and you don't even need to see the doctor. You hop on that. Yeah, and it is dangerous.
Yeah.
How do you really know?
I felt like I was getting a UTI.
Right.
And I found this thing on the internet because I was out of town. Found the thing on the internet. I like typed in my symptoms, and then they literally sent me a prescription. I didn't speak to anybody, and they gave me a prescription. I may have not had a UTI. I could have had something else. They don't know. I'm just telling you how I feel. But like, you didn't test me. Nothing.
You know, and the
it
problem
could
with
get
that
dangerous.
is, because, you know, as a urologist, the problem with that is you're over-treating with antibiotics. And number one, that kills your good flora, bacterial flora. So people get a yeast infection afterwards. So you can actually get a secondary infection. And then also, I mean, if you're just treating something, you don't know what you're treating, you can create resistance to urinary tract. I mean, we had patients coming through the hospital really sick, and every single antibiotic was resistant. So we had no silver bullet for this patient.
That's like me and the numbing.
You don't get numb?
I just can't get numb.
She
On
doesn't
this
get numb.
right side of this side of my face, cool, gets numb. This right side of my face doesn't get numb.
It's true.
But it's like that for me even at the dentist.
Yeah.
It just doesn't.
It just doesn't.
So I must have taken too many pills. Basically, I took too many pills and now I'm numb. No. So do you feel like your career, like your previous career, let's say it, and your career now, do they meet at any other points except for male erectile dysfunction?
That's such a good question, because I was trying to run away from urology for so long after I had such a bad taste in my mouth after I got fired. And I was like, I'm just going to do all aesthetics. And then women are coming to me and they're like, well, do you have anything for leakage of urine? Because, you know, not even after birth, but, you know, perimenopausal or even younger women, they have incontinence, which is leakage of urine. So that could be controlled, that could be, you know, prevented, that we could help that. And then also women with repeat urinary tract infections. There are other things besides medication that, you know, you can take for that. And then also women who, you know, either are deficient in hormones or going through a lot of stress. They get really dry, so they don't have that normal lubrication that they used to have. And so sex for them can be very painful. And they have pelvic floor pain and dysfunction, and they just don't have that sensitivity and climax anymore. So we have procedures that can help women achieve orgasms, multiple orgasms with penetration, with natural lubrication. I mean, there's a lot that we can help with urinary frequency, urgency, right? And I'm actually one of the key opinion leaders of InMode, and they have this platform called the Empower, which I love because it really helps with everything. It helps with vaginal tone, abdominal tone, buttock tone. It helps with, if there's a Morpheus, you guys heard of Morpheus, right? That's InMode. So I'm one of their key opinion leaders, but they've actually made a Morpheus for the vagina.
But that has to hurt. Does it hurt the same that Morpheus hurts?
No.
Because I got Morpheus done on my stomach to try and tighten the skin around my belly button from the baby.
Yeah.
It hurt more than having a child. Like, it was some of the worst pain I've ever felt in my life. So then I'm thinking about doing that on my face, and I cannot imagine doing that on my vagina.
Yeah. On the vagina, it doesn't hurt.
It doesn't?
No, it's internal. We numb you. It's a different, right? It's internal in the vaginal canal, and you don't have the same nerve sensation. And all it does is just thicken the tissue.
Out in there. How could you have
So so the Morpheus creates more collagen, more elastin. It gets you tighter. It helps with lubrication, decreases your urinary tract risk infections.
I'll talk to you guys in 3 years.
Take 3 years.
So my question is, are most of the stuff that you do for the vaginal stuff, is it mostly inside or is there stuff that it can be external too.
It can be external too. Yeah. We can do a Viva externally, which is a probe that tightens externally. We can do Morpheus externally. We could add PRP. We could have fillers, for the labia.
Fillers to their lips to make their vagina look more
fillers.
How am I ever going to find a man when people are out here putting fillers in their vagina?
No, I just
want everybody to know that this is
literally
a tricky world out here. You bitches don't have wrinkles. You just have plump cheekbones and you have tight vaginas.
We're out here fooling everybody.
It's hard.
We don't have to get old anymore.
Yes, exactly.
Oh my God.
I know for the Morpheus, like for my stomach, they wanted me to do it like
3
several
times.
sessions. Yeah. Is it the same for the inside, for the vagina?
It is, but you'll see a difference after the first one. Yeah, for sure. This one actually has the Morpheus, the gold needles that come out.
That has to hurt, Dr. Lanna. Have you done
man feels putting that
Have
needle?
you felt it?
I've not had it done to myself, but I've done it to every single one of my staff members who told me about it. And after they started begging me for their second one, that's when I got the machine. It doesn't hurt. Externally, it'll be a little painful, but not terrible. Promise. Promise. Come for a treatment.
I'm going to come. I want to try it out. I'm down to try anything. So this is also what I want to talk with you about. Because recently I've noticed that I feel like my face is starting to sag around this part.
Okay.
And so I was like, oh my God, I need filler. But my girlfriend told me, she was like, no, don't get filler. Try Morpheus, or there's some other lasers that'll kind of like tone and tighten the skin before you do fillers. Because like we kind of said, fillers can become a slippery slope where you have to constantly keep up with it. What do you think about that?
I think fillers got a bad rap.
Yeah.
Ever since like Madonna and everyone going out there saying it's this
crazy.
And it sucks that it's happened in our industry, that there are people out there that if you say no to somebody, they're going to go to somebody else. And there's going to be somebody else who's willing to take that person's money, you know? And it's really unfortunate. I think if done the right way, fillers can be it could enhance you and have a very natural enhancement. So I'm a huge fan of fillers. So what happens as we get older, we lose volume, collagen, and we lose fat, right? And we lose bone too. Our bone density decreases, which is so sad because you're like, where the heck did the collagen go? After the age of 18, we start losing our collagen, 1% every year.
Good thing I'm only 21.
Exactly. Good thing you're only 21, so you've only lost a couple of percentages of collagen.
You're good to go.
Yeah, you got good collagen, girl. But, you know, we do things like Morpheus, we do things like Sculptra to help like reproduce that collagen and also like stimulate your skin to give you some anti-aging. So I'm a huge fan of Sculptra. I'm a huge fan. Yeah, Sculptra is great. I'm a huge fan. It's a biostimulator. And I'm also a huge fan of Morpheus. But I do feel like fillers can be a really good adjunct, you know, and that it's a really good immediate fix, right? Where like you've lost volume, so things are starting to descend. You're seeing more jowls, you're seeing more nasal labial folds, you're seeing more, you know, more of that. But once you add a little bit back here, this is going to look so much more natural. I don't fill in these areas.
You're not going to fill here. You fill up here, and it like
for the
pulls.
lift. Exactly. You know, we call it the preauricular area, the submalar, you know, because you've got very nice cheekbones.
Yeah.
I don't want to make you more maleficent.
No, because
I want to
like
make
Madonna.
you softer, right? And more pulled back.
Yeah.
And we can do that very subtly, but impactful. Yeah.
And then here's my other question, because then my friend also was like, you don't want to do fillers because then all it's going to do is make you more saggy, because essentially it's like stretching your skin out and then you have to keep filling it. Is that a truth, or is that a...
That's probably the number one question I always get asked, right?
Yeah.
That's why I was worried about my lips too. It was like, I can't stretch this skin out. Oh no.
Right. So it depends on the tissue.
Okay.
Like there's some people like with lips and with cheeks, you know, they have really deflated skin. So, and they've lost a lot of weight very quickly. So yes, to reinflate them, you're going to have to add filler, but you're not overstretching them to a point. So I don't overstretch. That's why I don't do more than like a half a cc to 1 cc per session. I've never really done over 1 cc over 1 syringe of filler because I don't believe in overstretching the skin. If you stretch out any skin, any muscle for a prolonged amount of time, I always, you know, talk about like the balloon that's been overinflated, and then when you deflate the balloon, right? But we never get to that point where we're really stretching those fibers. We are just replacing your lost volume.
Yeah.
So we're not going above and beyond and stretching your skin. We're just going to give you back that volume that you've lost already.
You've lost.
Exactly.
Okay, so
that
that's
doesn't
sort of
stretch
a
you out.
falsehood. That's not really true.
Exactly.
So are they going to ever find anything else that we can put in our butt besides Sculptra?
Besides Sculptra, Radius.
Radius. Like there's
You
got to
have no
be
fat.
something between this the stuff that
And the butt
people are-
implant.
Exactly. Like there's got to be some happy medium. Someone needs
There
to...
is something called
is it?
Renuva, which is like cadaveric fat.
Yeah.
Yeah. Someone
like
else's
fake fat.
It's like, yeah. Fat.
Like
that
dead
expensive?
fat.
Dead fat.
I don't know if that word that starts with a C, that sounded like
Cadaver.
someone who's dead. Yes, Ashley. So you're going to take a dead person's fat that they didn't even mark on their license.
Maybe.
When they marked their license, they said they were willing to give their organs, not their fat. And now you're taking this dead person's fat to put in your ass.
I feel like they might be okay with
cheaper
that.
than Sculptra?
I could give you my fupa. You want my lower? You could take the fat from my
Can
lower
you?
stomach.
That's what I've always wondered, because it's
Why?
like everyone's always like, oh, just get a BBL. But I'm like, I don't have enough fat
You don't
to
have
get a
enough fat.
BBL, and I don't want to gain weight in order.
Right.
Like I'm not doing that, so
Yeah.
I can't get a BBL. So there's really no other option. But what's this Renuva? Let's talk about it.
Renuva. Yeah, Renuva is expensive.
Oh, it's more expensive?
It's pretty expensive. I actually don't use it in my practice.
Yeah.
But it's basically fat that's, from a cadaver, and then we inject it. But here's the thing. People are doing BBLs for like 800 mLs, like 2 liters. Like, it's crazy. Now people are reversing some of their BBLs. Have you seen that?
It gets out of control, and people don't understand. Like, when you get a BBL, you have to keep it up because now all those fat cells. So then people get all these very distorted, like shapes because
hip dips, indentations, and so they just want to fill more. But people are actually starting to reverse it. I mean, it's a trend that got very popular because of the Kardashians, to be honest. And
isn't that crazy? Yeah, how they have like basically made a world full of girls who want butts.
Who want to look like them actually from head to toe.
100%.
It's not even just the butt.
And their bodies aren't even real. So then we're just trying to achieve something that isn't even
correct. It's all photoshopped and
then
real.
they have taken it out by this point also.
Yeah. Oh,
right.
And 100%. They have the money and the ability and the doctors to do so.
Fluctuate.
Yeah.
And then we're all trying to do it, and then we're stuck with our disformed asses.
Yep, unless you watch shows like Ask Ashley and you get to find out people like Dr. Lanna.
Oh, yeah.
Free game. Free game, free game, free game.
So Renuva is more expensive than Sculptra or Radius.
Yeah, I would say so.
I don't actually know the price points for any of these things. So what are these price points like?
If we don't put enough Sculptra in your booty, you're not going to see a huge difference. So we always say, like, we want you to get at least 10 to 20 vials because it's really not that much at the end of the day. Sculptra is a little bit different. It's polylactic acid, and it's powder that we mix with sterile water to get it into the area, into the buttock. And the water goes away, right? It gets reabsorbed over a few days, and then you're just left with the powder, and then that powder stimulates, the collagen. So you kind of get this initial like booty swelling, which people show on, the internet, like, wow, look at how big the booty is. But it's mostly water, and then it goes down. Then it kind of comes back, I like hyperdilute Radius because it's a filler, and if you don't dilute it as much, so you can control the dilution, you still get the biostimulatory effects of increasing collagen, making your butt look really nice, and the skin like really nice and porcelain. But it gives you that initial fill. So I like Radius for that.
The most.
Yes. So our non-surgical BBLs can be anywhere between 10,000 and up.
Because you really don't want to do anything less than 10 vials. And it'll be like at least, even with like a very special price, it's probably like 500 a vial.
Exactly. We do go down to 500 if they get a certain amount.
Yeah.
But, the stuff itself is very expensive, right? The companies do that on purpose.
There's something still that does inside of me feel a little bit uncomfortable with feeling like the way to solve what we're insecure about is cosmetic.
Right.
It does feel like there's so much more work that needs to happen internally for you to even value or appreciate the work that you're getting done. You understand what I'm saying? Like, I would feel like if I still had those insecurities, you could put 18 vials in here. It's deeper rooted inside. So there's just something about me that sometimes when I listen to these conversations that it's like, yeah, damn, I trust you. You're smart. You know everything you're talking about. Damn, I know you would do your research before you jumped out the window and did something like this. But it's also like, but what's the real issue?
I think that a lot of it comes with like social media. And like you said, like these bodies that we see not in real life, and they're photoshopped, and we're constantly seeking like perfection. So like I'll go to the gym. I go to the gym 4 times a week at least. And I'm lifting and I'm working out. But it's like, I still can't get that shape that I like ultimately want. So I'm like, I'm doing all this hard work, but I'm still not achieving what I ultimately want. So what else can I do to have this perfect butt that I'm have in my head? You get a little bit crazy.
It's interesting. I guess I never thought about it from the perspective of feeling like you're doing everything you can.
Yeah.
Right.
And I think that's actually the difference. And it's not like you don't put in work at the gym.
Yeah.
It's not like you wouldn't eat certain foods if they said eat these foods. Like
I would do
you
whatever
would
it
do.
takes.
You're right. You would do whatever.
But what I will say is, because I always joke about it, and it's like, okay, am I really going to do it or whatever? And I haven't done it. But the other day I was at the gym and I was like working out, and I'm joking with my trainer because we always joke. I'm like, yeah, I'm going to get ass shots, like da-da-da-da-da. And then I'm literally walking to get water, and this woman on the treadmill looks at me and she's like, I don't want this to be weird. She's like, but you have the perfect shape. Like your body is so symmetrical and like your shape with your butt and like your shoulders. She's like, your shape is so nice. And it's like those moments like that where you're like, yeah, okay, Ashley, like you're crazy. Like you're seeking something that isn't even realistic, right? You know?
We always see ourselves and we are the worst critics of ourselves.
Yeah.
And we pick ourselves apart. You know, even if someone says you look beautiful, we're always like, no, I don't. Stop it. Shut up. You know? Like it's hard.
Yeah.
Like
my hair's not done. I don't like it.
Yeah.
In this outfit, like
there's always something.
There's always something, but you're absolutely right. A lot of it is unachievable because it's not anatomically normal to have, you know, a booty like that. I mean, we do have something called tone, which basically is a EMS. It's electric muscle stimulation.
I did that on my stomach.
You did that on stomach?
I liked it.
Yeah. And we have people that come in for the booty.
Yeah.
And it works well. It's like doing all these, you know, squats without doing the squats.
5,000 squats in 30 minutes.
Listen, I'm for all the things. But it's like nice because it's like I put in real work and then I'll put in fake work too.
Yeah.
And that's why also I think it's important to find a doctor that matches your mindset, which is why I think you're dope, because I think you carry that mindset where you're not going to go for unrealistic.
Right.
Like you're going to move people slowly through the process. And there's a lot of doctors that don't. And that's why people end up looking crazy.
That's right.
They do.
Yeah. I'd rather like under promise and over deliver, you know, and just give them like the real, like you're a good candidate or you're not a good candidate for this. And maybe this procedure is not for you.
It's funny because in doing my research, like looking for people that I wanted to try to get lip filler from, I looked at what I felt like the doctors had done.
That's
and
a
so
good
I
point.
looked at you and I actually couldn't pinpoint the work that you had done.
Yeah.
And I was like, okay, I like this.
Yeah, natural.
Yeah.
Will you tell us what you get done?
Yeah.
Okay.
I mean, I love my lip flips.
Yeah.
You know, I've had lip filler before. I love my cheek. I love my jawline filler. I love my chin filler. Chin for me is so
Because it's like
key.
that, like
It's like that.
the
It's
side
like that
profile.
heart shape, like V shape. It helps to decrease the submental fullness.
Yeah.
You know, because I have a lot of it. You know, so I'll just put some behind the posterior jawline. I'll put a little bit here, and it just snatches up that jawline.
Yeah.
And then I do my cheeks, even though I have big cheeks, but I need to decrease some of this here, so I do a little bit there.
Pull it back.
And I do, and a little bit of temple, just to give me a little bit of that brow raise. And I love Botox. I mean, I use Xeomin, which is like it's a more pure form of Botox. So I love that.
Oh, do you have that in your office? It costs more money, huh?
No, girl, we do the same.
Okay.
What's
I want to
the
switch to the
other
pure.
Botox?
I want to switch to the pure one next time I come in.
Okay.
The last time I got Botox, I didn't get Botox, but I didn't get that. What's another one? Dysport. That's what I got. What do you think about Dysport?
Dysport works very well. It's
Okay.
probably the most consistent toxin on the market. So that's everybody's go-to. I mean, it's my go-to.
Yeah.
For me, I feel like it could be a little bit too heavy. So I go a little bit, so I do Xeomin for me. So like for Asians that have like, you know, these little itty bitty, you know, muscles. But for those like the men
Like this
or
giant
thicker,
forehead can take Dysport.
Yeah. I mean,
They looked at my forehead and were like, "No, you need
the
the
Dysport.
you need the
you need the
hard
strong
stuff.
one.
You need
Yeah,
the
you need the
strongest
strong
thing we
stuff.
got."
We can't make her unhappy. We got to make sure
we
this
gotta
works.
give her the good
the good stuff. So Dysport is the good stuff, you know.
Okay.
Then there's Daxi. Daxi is Daxify. It's the latest one on the market. It just got FDA approved like 6 months ago, and it's supposed to last 6 months.
Oh, so it lasts longer.
So it lasts longer. You have to do twice as much.
Yeah.
Daxi. So it's like you're paying for double. So I mean,
So you
But
might
you
as
gotta-
well
you'd have
just
to
do
come
the other
twice.
one and then come twice, and it's like the same thing.
I mean, it's
unless you don't like being shot.
someone
like her,
me,
like her.
yeah, I don't want to come twice. I
Maybe.
want
You want
shoot me up one now. I'll see you
Yeah.
see you in July, Doc.
Yeah.
Yeah, that's how I want it.
Can I also mention one thing, and I know we're probably off, but some nurses are not able to inject pain medication. So if you go to a place that you're not being taken care of by a doctor or a nurse practitioner, an advanced level practitioner, you're going to have more pain because they don't get the good stuff.
I'm such a baby. I had to have nitrogen, Ashley.
Nitrous, yeah. She's like on a nitrous.
jealous. That's the
Laughing gas,
right?
yeah.
I didn't laugh one time.
You were still
Did it help you?
It should help you relax.
I think that I was even more nervous about taking the laughing gas incorrectly. And I'm like, I can't even breathe right.
Oh,
Now I'm like,
you're all in your
Felt like a
head.
total failure.
I felt like a total failure.
Oh, honey.
Most of these med spas are more like nurse practitioner or nurse ran, and they just have a physician that kind of oversees it. But you are really there and like really doing, and that's what makes the difference. Would you say?
I think so. Yeah. We have plastic surgeons, and these are board certified plastic surgeons, double board certified, facial plastics, oculoplastics, so OBGYN. So it's not just someone who's taken a course.
A course. Yeah.
They say black don't crack, but it ages. The final straw for me was that I was looking at myself on camera, watching these videos and seeing my gummy smile that finally was like, oh no, I can't take it anymore.
Right.
What do you feel like is people's like most last straw that gets them to come and sit down in your office?
Yeah, that's such a good question, because I had people follow me for years, right? And then they finally pull the trigger.
Yeah.
I'm going to tell you like the 3 top reasons.
Okay.
Number 1, divorce.
Ooh.
Divorce will make people come in and be like, screw it, I'm taking care of
I
myself.
want to be freaking hot.
Yeah, exactly. I'm going to be hot after
I've
this
been worrying
divorce.
about him or her or the kid, whatever. It's me time.
Yeah, actually,
time.
that's number 2 is kids. My kids are finally older. Now
Yeah.
it's time for me to take care of me and do me.
Yeah.
Right? So that's number 2. And then number 3, you know, I would say it's a toss-up between maybe just wanting to feel a little bit sexier, maybe wanting to look a little bit better, and having something important come up, whether it's a wedding or something, you know. And then the other thing too is I find this is why I love social media, because we are so diverse. When people come to us and they see someone on my social media, like, okay, I kind of look like her, and that's my problem, and I want to come in. And I remember one of my friends, she's beautiful and blonde, right? But her whole office staff is beautiful and blonde. Right. And so I would feel super intimidated to go to that office because I'm not beautiful and blonde, you know. I'm like,
you're like,
so you know, so I love the fact that, you know, I see that people come in because they're like, you know what, I've been following you for so long, but then I saw you did this, and then I was worried about my neck, my turkey neck, and that's why I came in. So it's almost like, you know, they see somebody that looks like them, and they're like, that's what my issue is. So I think that's probably the 3rd reason that people are like, okay, I'm gonna just take the jump and come and see you.
That's awesome.
Yeah.
Ash,
Yeah.
before we have to pay her for more of this consultation, you got any other questions?
No, I think I'm good.
Yeah,
I think I got all
okay.
my
So you'll see her on
answers.
Tuesday.
Yeah, exactly.
We'll do the
coming
booty
back.
lift.
Yeah, we're
We'll
gonna do it all. We're just gonna
Yeah.
lift my whole.
We'll do a little
Everything.
lift here. Yeah.
I love that. Well, on every episode, we have something called question time. So we prepared 3 questions that we're going to ask you that just will allow the people to get to know you a little bit more.
Okay.
What are you most proud of so far this year?
Great question. All my life, I've just kept my head down. I was like the obedient Asian girl.
Yeah.
My parents escaped from China. They built a raft. They had ping pong paddles. They had a compass. They escaped from communism. And they came here against all odds. They got drugged on a boat to get smuggled into Hong Kong just so they wouldn't make noise. They came to America with $6 in their pocket. Like this is the American dream, right? So like as an immigrant, like, you know, from an immigrant family, being first generation, I never took anything for granted. And so I kind of like did everything I was supposed to do, got my medical degree and you know, became this robotic surgeon. I'm like female robotic surgeon. There's only 8% of women in urology, and I'm one of 8% of women. So I've always been like such a like super high achiever because of my background, because I knew I'm not going to take my parents' sacrifice in vain, you know, but I never really did anything kind of past that. I was just following the path of what my parents told me to do. And so, you know, we're in a recession. I think everybody's feeling it a little bit. Everyone's a little bit nervous. And I decided to put myself out there a little bit more, and doing a podcast like this with you girls, which is amazing. Because I love your podcast. I love meeting you, Ashley. And that's why I'm like, I'm sticking to my commitments. I'm saying, yes, I'm going to put myself out there. Maybe I'll cry. You know? Maybe I'll cry because, you know, talking about my family, it always makes me very super emotional. For a long time, I was very guarded. I kept everything quiet, didn't say anything. And it doesn't make you grow as a person. And I just found that when I go out there and I like tell my story and I'm my authentic self, and, even though I feel like, like
Overwhelming
it's
a little bit,
overwhelming. What are
yeah.
people going to think about me? I feel like it creates that connection.
Yeah.
So I feel like one of the biggest things I'm most proud of is putting myself out there more and creating authentic connections, with people, like amazing people like you guys.
Yeah.
I'm really proud of that, and then also reaching out to different people, not to like necessarily for leverage, but people that are around me that are in places that can help me and asking for that help and then being put on like, headlining stages and being on stage to talk about something, which
We
I'm
saw you in Forbes.
terrified.
We saw you in Forbes, girl.
Thank you.
Yeah.
But none of this would have been possible if I just didn't just change a little bit of my mentality to say, you know what, I'm going to put myself out there. I'm going to make connections. I'm going to talk to people, and you never know, I'm going to help people. I found that helping other people without expecting anything in return has given the most dividends. And I don't do it to get other people to do things for me, but it really, I think part of my success is attributed to the fact that I really want to help people,
Purely, yeah.
train people, teach people, and I think that, really has opened up a lot of different doors for me. So that's what I would say.
Not that you need my advice.
I
in
love
any way,
your
shape, or
advice. Are you
form.
kidding?
But I will say that the way that you touch people in your practice, you're going to touch them even in a whole different way by sharing your story. Ashley and I, we are adamant about being ourselves on this show.
Yeah.
We don't try to pretend. We don't.
Yeah.
And the fulfillment that we have found from people all over the world
Love it.
Yeah.
is
Love it.
because we were just willing to say, hey, like today sucked.
Yeah.
Yeah.
Yeah. Let's talk about that.
Let's talk about
so that
how
other
much
people may feel
today
better.
sucked.
Yeah.
Today sucked.
Well, because
But
there's
in this-
always someone that's going through something similar to you,
100%.
and you stay quiet, and someone else might stay quiet, and then you're quietly struggling when you could be helping each other. You know what I mean?
Right.
100%.
Absolutely.
Yeah.
Absolutely.
That's dope. That's something great to be proud of. So
That is
we're
amazing.
gonna continue to champion
Yeah.
and push that.
Yeah, for sure.
Love it.
Okay, so the next question for you is, who is your best friend?
My best friend is my nurse practitioner.
Really?
Yeah, Christina.
Mm-hmm.
And it's really interesting because she's closer to me than my family members.
Yeah.
But she's somebody that's like, what do you call that? Like a ride to die?
She's a ride or die.
She's a ride or die.
Yeah.
Yeah. She's my ride or die.
Yeah.
Her and I
Yeah.
are very similar.
Yeah.
And it's so good at the end of the day if you're just like, oh my gosh, it's been such a crazy day.
Yeah.
To have that bestie like you guys do and be
Yeah.
like, let me tell you about my day, girl. Like,
Yeah.
no, let me tell you about my day. And
Yeah.
you're like, all right, we're good. Okay, this
Yeah.
is good. You know, we all need that person that we could
Yeah.
that can relate to us and just be like, okay, one day we're crazy. One day she's crazy. One day I'm crazy. One day we're having a bad day. So like we bounce off each other.
Yeah.
So yeah, Christina is my best friend.
Were you guys friends before you worked together, or did you work together and become friends?
No, it's so funny. There's a saying that goes, and I may have made this saying up, but your, I think maybe I made it up. Your patients will become your friends faster than your friends will become your patients. And that's absolutely true. All of my patients are my friends now.
Yeah.
But my friends are like, you know, hey, you going to get me this for free? Well, no, I have to pay for this stuff.
Yeah,
It's
it's
expensive.
not-
like,
it's not
you know,
free
if you're
for
my
me.
real friend,
Yeah.
you want to pay me, you
Yeah.
know? So she came in and she took my course. I know she's a true friend.
Yeah.
Yeah.
So
That's great.
Yeah.
That's dope. Shout out to Christina.
Shout out.
And so the last question is, you spend a lot of time, you know, with that moment where the women look in the mirror at the end of it and they feel beautiful and they're proud and they're happy. So I want you to take a second, and I want you, if you could give yourself one compliment right now, what would you look in the mirror and compliment yourself on?
does it have to be aesthetics?
No.
No. Okay. Oh gosh, don't make me cry, you guys.
Yeah,
My
no, we
Lord.
cry all the time.
We do. We cry over here. We cry over here. Sorry, we didn't mean to.
Oh.
Sorry.
No, it's okay.
Yeah.
I would say like perseverance.
Mm,
Just not letting people tell me I can't do things.
yeah. You're a fighter, a
You
soldier.
are, yeah.
You're a
You
soldier.
have to be.
You have a great story to
You-
tell.
Thank you.
Yeah.
Please continue to tell it.
Yeah.
Write it.
Thank you guys.
Write
Yeah.
it. Speak it out loud.
Yeah.
I saw you have a Patreon.
Yes.
What's happening? Please, 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 please.
Yes.
Fix
I
your
mean-
mascara. Natasha did this good. She did our makeup
Like,
really
hold
well.
on.
We gotta fix this up a little bit. Go ahead, Ash. You got it.
This is why I have my tissue.
not.
Like, don't make me cry.
Not this, not.
So now that everybody's fallen in love with you,
Yeah.
And it's going to be impossible for me to get a damn appointment.
Yeah. Just remember Ashley and me.
Please.
When you're completely
I don't know. Do I need a code
gosh.
to hit so that I can get through?
You guys can come anytime.
Usually we like to hoard our good secrets, but we'll share this one.
We'll share you.
God. There's a promise so we can get in.
Yeah.
It's funny. We have a girlfriend, Lisa, who owns a laser salon in on 7th and like 29th or 30th. And I always promo all her stuff. And like now I can't even get in.
You're like, darn it.
Yeah.
Damn, girl. Like, I can't even
did all
get
this
in.
and now I can't get in.
I can't get an appointment. But yeah, please tell the ladies where they can find you, how they can follow you, all that good stuff.
And the men.
Okay, so I'm Dr. Lanna, and I'm on Instagram as DoctorLanna. My website is drlanna.com. I'm also on Patreon. I do a lot of injectables training, and we're opening up in New Jersey. So
yes. And if there's someone that's looking to train and take your courses and all that, they can find the details on the website.
Yes,
Okay.
yeah, everything on the website or DM me. I actually answer most of my DMs.
Yeah.
Yeah, so
That's
it's very easy to get in touch with me.
Listen,
Wow,
y'all,
this has
get
been
on,
great.
get on early because they listen to
she's
these
legit.
episodes.
Yeah. Yeah.
We're so happy to have you here.
Thank you guys so
Yeah,
much.
thank
You
you
guys
for
are
coming.
amazing.
We're coming back in a few weeks to
Okay.
do my touch-ups. I
I'm
might
gonna-
drag Ashley with me.
Yeah.
Oh my gosh,
I'm
she's
gonna
in
come
town.
for sure.
Yes.
For sure.
Yeah.
We're grateful.
Yeah. Thank you.
Appreciate you.